Hello everyone, this is Dr. Kitpal Singh, an MD from CMC Ludhiana, and today I'll be talking about another pertinent, important topic, that is prescription. And we often do tend to write prescriptions, and that is what we generally do. I would talk about some errors and ethics that are associated with prescription. And I hope that by the end of this session, I would be able to give you a suitable format for prescription writing. And if there are any queries regarding this particular aspect or this particular topic, you can text me and I'll definitely get back to you. So we start with the definition of what prescription is. A prescription is a written, verbal, or an electronic order that is given from a practitioner or a designated agent to a pharmacist for a particular medication for a specific patient. So you have a written, verbal, or electronic order which is given by a practitioner or a designated agent, and it is given to a pharmacist for a particular medication for this particular specific patient. Now, doctors are often known for a bad handwriting, and this is what is depicted in this particular uh, cartoon character that shows that a person went to a pharmacist and he says that this is what it says. It says that a tablespoon should be given 300 times a day. So these are some things. Now, what are the common types of prescription that are there? The common type of prescriptions are prescriptions that are given for general practice and prescription that is given for inpatients. So we'll be talking about the various steps for prescription writing. So the steps that are there for prescription writing are you need to make a specific diagnosis. You need to consider the pathophysiological implication of the diagnosis. You need to have a specific therapeutic objective for this particular diagnosis. You need to select a drug of choice, an appropriate dosing regime. You need to devise a plan to monitor the drug action and determine an endpoint of therapy. And you also need to plan a program for patient education. So our job doesn't end at the point where we say that we don't need to go beyond this particular aspect. This is one of the prescriptions that is there, that is given in the pharmacological basis of therapeutics, that is given in the Goodman and Gilman, and this is the prescription that has been taken from this. So this has this particular details of this particular physician, the date, the name and address of the patient, the age, and his weight. These are parts of superscription. Inscription, we have the receptor part, and then we have the drug that is being given, and then a direction to the pharmacist to dispense 30 tablets. And direction to the patient is to take one tablet by mouth daily in the morning for blood pressure control. You will find something others that is there out. This is followed by the signature and date of the physician. Obviously, his degree also has to come out here. And then there is another thing that is refill. That means the number of times patient can go to the pharmacist and take the requisite number of tablets. So what he does is, after 1 month, he goes to the pharmacist. The pharmacist again dispenses 30 tablets and cuts this from 6 to 5 times. And then there is followed by a generic substitution column, which says that we don't have any problem if generic substitution is given. So the prescription must be accurately and legibly prepared to identify the patient, the medication, the mode of drug administration. We need to avoid abbreviations and Latin because they lead to dispensing error. Include the therapeutic purpose for the prescription. Like in this particular prescription, we used for the control of blood pressure. For the treatment of hypertension, you may require 100 milligram, whereas for congestive heart failure, we give the same drug, the dose is less. You have to include the therapeutic purpose of prescription, and it helps in organizing and understanding the medication. Includes the patient weight on the prescription so that dosing error can be avoided. Now, in the contents of the prescription, the first thing that we need to take care is selecting the drug. We should just have few things that we should keep in mind. What is the allergy in this particular patient, the availability of the drug, and the cost to the patient. So if the drug is too costly or patient cannot afford it, he would not take it. Then the next thing is you need to name the drug. So just keep it very simple. Don't go for multiple drugs per prescription which can be added. Now, these are some prescriptions that have been taken from the Google Images. You have this particular 3 prescriptions out here. One is Zendril, ferrous sulfate, and Hamilton L. Now, what is to be avoided? You should avoid the use of abbreviations because not all drugs have abbreviations. We tend to use abbreviations like HCT for hydrochlorothiazide or MSO4 for morphine sulfate, but these are not the standard abbreviations. If there are any standard abbreviations that should be used, but any attempt to standardize abbreviations have always been unsuccessful. So avoid the use of abbreviations. Once you are closing it, you should go for prescriber signature. There should be refill instruction and generic substitution instruction as shown in the example. There were these 2 columns were there. There was a prescriber signature with his registration number, the refill instruction was there, and generic substitution was there. Okay, which I remember. The next thing that you need to know about the content, you should be familiar with the strength of the drug. You have to be familiar with the drug and the various dosing strength and dosage form. And it is always advisable that if you have any doubt in this particular thing, always tend to use a reference. Always give your dosing based upon the weight of the patient. Always converts patient weight to correct unit, that is in kilograms. Regarding liquid medications, one product may be available in a number of concentrations. You have to be familiar with various product concentrations, indicate both concentration and dose of medication. Jaise, like cephalexin suspension, 125 milligram per 5 ml, 1 teaspoon every 8 hours. And you should be very sure what exactly that you are in the same term as with the patient. If we say 1 teaspoon, it should be same as it meant for us as it means for the patient. Regarding the strength of drug, when we talk about decimal points, avoid trailing zeros. So 5 milligram should always be written as 5 milligram and not as 5.0 or 5.0 as sometimes we often tend to do, because there is all possibility that this decimal would be missed and it would be read as 50 milligram. And if there are leading zeros, you should always use them, because if you write 0.8 ml or 0.808 ml, it gives a better understanding versus 0.8 ml, where it is all possibility that patient might be given 8 ml, which is too high a dose for this particular patient. You should always prescribe only the quantity that is necessary. Write for specific quantities rather than time period. For example, dispense 30 tablets rather than dispense for 1 month. And how do you calculate it? You calculate it upon quantity. The quantity is the frequency per day and the number of frequencies. Supposedly, this if it was 1 tablet per day, so this times 30 tablets. If it is 2 tablets per day, then it's 60 tablets, and so on. Then, when we write quantities, 1 gram should always be written in gram. But if it is more than, then you can write 2 gram, because 1 gram, it tends to always create a confusion. So it is better to write grams after 1. Quantity of less than 1 gram but more than 1 milligram should be written in milligrams. Supposedly 100 milligram and not 0.1 milligram, because this does 0.1 gram. This does tend to create a confusion. Quantity less than 1 milligram should be written in micro or nanogram as appropriate. You should not abbreviate micro or nanogram, because this could lead to prescribing error. For example, 100 micrograms and not 0.1 mg or 100 mcg or 100 microg. Use ml or ml for milliliters. So you have to have a standard abbreviations that are being used. Then there are some situations where you might need to state the maximum dose for a drug. For example, ergotamine in migraine and colchicine in gout. Let's talk about ergotamine. So ergotamine has to be given 1 milligram at the onset of attack, repeated every 30 minutes if necessary, Do not take more than 6 milligram in one day or more than 12 milligram in 1 week. So what are we doing out here? Because it is a toxic drug, so we need to mention the number of tablets that can be taken. If it is, let's say, 1 milligram tablet, so not more than 6 doses in a day and not more than uh, 12 doses per week. Regarding the directions for use, you should write out in full English and do avoid Latin abbreviations. Although Latin abbreviations are more convenient, but they are potential for mistakes. So we should avoid dangerous abbreviations, provide clear and specific directions to the patient. Everything should be clearly indicated. Atenolol 100 milligram, not like amoxicillin 250 milligram. Tell the patient what you mean by these times a day, 4 times a day. What is the exact interval that you need to define it to the patient? This is one of the charts for the inpatients where you have the drug, the strength, the dose, the frequency, the route, the signature, and the number of days and signature of the doctor in charge. Now, there are certain examples. Now, what is this? This is a particular prescription that is taken for. We are not sure what exactly this prescription means. And this is poor handwriting, which has contributed to medication dispensing error that resulted in a patient with depression receiving anti-anxiety agent Buspar 10 milligram instead of Prozac 10 milligram. Let's look at another example. A hypertensive patient accidentally received Ventin 200 milligram instead of Bezotec when a pharmacist misread this prescription. Then certain more, a patient died after receiving an epidural infusion containing 30 milligram diamorphine in 10 ml instead of 3 milligram in 10 ml. The doctor's prescription had been misread. This was in 1996. Abbreviations of the word unit to IU resulted in the administration of 10-fold overdose of insulin when prescription of 6 IU was misread as 61 units. A baby weighing 3.2 kg was prescribed 10 micrograms per kg. When the presented prescription was written, the decimal point was omitted and a dose of 320 milligram was administered. So these are some prescription errors which we need to keep in mind. Now let's talk about these two prescription errors, where we have a one chart where it says alendronate, you have the signature, you have the print name and designation, the dose, the date, but then nothing beyond this, and it is written only weekly. But out here, when we talk about the 10 days, it's the same, and this is much better because it is mentioned that this has to be taken on the second day and then on the 9th day, clarifying that no drug has to be taken at 9 a.m. on the first day, third day, fourth day, and so on. Similarly, digoxin, Lasix, and warfarin, where we have not mentioned anything how it has to be taken. Now, these are certain prescriptions that contain errors. Comment on the prescription, think about how. So we have Mixtard 70, we do not have any unit to be given at 9 and 9 a.m. But what is this? 7U, 70, whatever it is. Phenytoin 1 gram, it is more of a 19, given by the IV route, 9 a.m. and 5 p.m. So now it is a legal obligation to write clearly. Doctors are legally obliged to write clearly as emphasized in the UK Court of Appeal rule in the following case. A doctor had written a prescription for amoxil tablet, that is amoxicillin. The pharmacist misread this and dispensed Dionel. Instead, the patient was not a diabetic and suffered permanent brain damage as a result of taking this drug. The court indicated that the doctor owed a duty of care to the patient to write a prescription clearly and with sufficient legibility to allow for possible mistake by a busy pharmacist. The court concluded that the word amoxicillin on prescription could have been read as Dionel. It found that the doctor has been in breach of his duty to write clearly and had been negligent. The court concluded that the doctor's negligence had contributed to the negligence of the pharmacist, and that is how things go. So you have to write it clearly. Now you need to be aware of drugs that fall under Schedule 1, Schedule 2, Schedule 3, Schedule 4, and Schedule 5. Schedule 5 are drugs those have high uh, potential for abuse and they are not accepted for medical use. Schedule 2 are also have high potential for abuse but are currently accepted. Schedule 3 drugs are abuse potential less than 1 and 2, accepted medical use, and it may lead to mild to moderate physical dependence. Schedule 4, abuse potential less, currently accepted, and may it has limited physical or psychological dependence. And as we go down the the particular dependence and psychological and physical dependence tend to decrease as we go from schedule 1 to schedule 5. So this is what we need to follow. Name, address. This is one of the inpatients. You need to write down the drug, the dose, the frequency, the number of days, and you need to write the name of the drug. You need to add the formulation. You need then the number of tablets you want the patient to be given in words. 56 capsules, include the dose and frequency. So now, to maximize the patient's safety, it is always said to write legibly, to always space out words and numbers to avoid confusion, to always complete medication, to avoid abbreviations, and when in doubt, you are always asked to verify. So, this completes your topic of prescription ethics and error. I hope I have been able to clear some doubts, and if there's any queries, you can get back to me, and I'll be happy to answer that. Have a nice day and happy learning. Thank you so much for your patient here.